Now, let's get into the weight loss. Wegovy, Zepbound, semaglutide, tirzepatide, Ozempic, Mounjaro. We've heard all of these different names. What are they? They are all GLP-1 weight loss medications. What they do, so I'm going to group them for you. So Ozempic is for diabetics. So if you are not a diabetic, your insurance is not going to cover you for Ozempic. The Wegovy is same company, same medication, but it is approved for weight loss. Semaglutide is a generic form of Wegovy. Does the same thing. It is approved for weight loss. What I tell people with those medications, oh, and now, as of last Monday, Wegovy now has a pill form that you take every day. Weight loss still does the same thing. You just have to take the pill every day. And this may be a little bit more comparable for people to actually pay for the Wegovy pill form if your insurance does not cover it. But you do have to take it every day. Now, how does this work? These medications work in the gut. And what they do is they actually send signals to your brain that you're full. So one of the things that was happening for a lot of people is that they were taking the medications and they stopped eating because they didn't have an appetite. What that does is make your body feel like it's in starvation mode. And so now it starts to kind of store because it doesn't know when you're going to feed it again. And the body is smarter than what we think. It is going to try to prepare for survival. So, what I tell people when you're on those medications, you have to eat. The goal of the medication should not be strictly for you to lose weight. The goal should be for you to help you change your lifestyle. So, what I encourage all of my patients who are actually doing those injections, your protein intake has to increase because if you're not getting enough protein, you are going to lose muscle mass. I encourage all of my patients to lift weights because lifting weights actually builds your muscle mass, but it also builds stronger bones. You have to make sure you are getting enough fiber because one of the side effects of this medication is constipation. If you're not getting enough fiber, you have to do the water when you do fiber. Because if you don't do enough water, and I say it should be technically half of your body weight, but minimum should be 64 ounces of water every day. So get those big containers. We all see everybody walking around with it. It's usually a 40 ounce. Um, Sometimes they're bigger, but if you fill it up twice, well, you've covered the day. But you have to do your water when you do fiber. If you don't, that bloating is really uncomfortable. The fiber needs the water to absorb so that it actually helps to move stool out. So, weight loss is not just about taking a medication. This should all be about a lifestyle change. I try to make sure people are very intentional on what they're eating and knowing what's in the food that you're eating. Know what a serving is. Every products are very different. So if one brand, it might be 20 carbs per serving. Another brand, it might be 40, or the serving size may be different. So those are things that you have to know. I also tell people when you go to the grocery store, eat before you go. Because when you are hungry, everything you see, you want. And you will put all that in your cart, whether you should have it or not, because it's going to overtake you. So eat before you go. And more importantly, when you shop, make sure you stay on the outer edge of the grocery store. If you are going down a bunch of aisles, that is all processed food. Processed food is going to either have high salt intake or it's going to be more carbs. So you have to really be aware of what you're eating. Increase your fiber. If you don't want to take a supplement, beans have high fiber. Make sure you are getting enough water. Chia seeds have high fiber. Look at it and make sure you're only doing one serving, because I've had some bad issues with doing lots of chia seeds and it bloats you. So do one serving of the chia seeds. Now, that's Wegovy. Then on the other hand, we have Mounjaro. So Mounjaro is for diabetics. Zepbound is for weight loss. Tirzepatide is the generic form of it. So that's how that works with Mounjaro and that group. They've done studies. There is, for people, they've shown that people lose a little bit more weight with the Mounjaro. However, everybody's not covered for, all the insurances won't cover that. I do tell people that if you have sleep apnea and it is moderate to severe, a lot of the insurance companies will cover Zepbound for sleep apnea, but you have to have sleep study. So I'm giving all the tips and all the tools. If this is something that you're interested in, don't go into it with want to lose 30 pounds and not change anything that I'm doing. Because once you stop those medications, if you have not changed the behavior, if you have not changed what you're doing, the eating, the exercising, the sleeping, and watching what you're eating. I tell people, if you're drinking a lot of wine, so any of the things that you're drinking, look at it, because it usually has a lot of, if it's anything other than water, usually it has a lot of sugar in it. So juice, wine, mixed drinks, soda, all of those things are going to have high sugar contents. So you have to be aware of what you're eating. Mental health is a huge issue with weight loss. Menopausal changes can also affect weight loss. What I tell people is that the more high stress you are, cortisol levels will increase. Cortisol is a survival hormone. It is going to have you store. So I always tell people, meditate in the morning. When you're under stressful situations, take those 60 seconds and take deep breaths in and out. It'll feel like eternity. But once you're done with those 60 seconds, you feel better. So that's my little informational sheet for the weight loss. There are other medications other than the GLP-1s. There is phentermine, but you have to be careful with phentermine. It is a stimulant. And so for some people, it can cause insomnia. For some people, it can cause them to be very jittery because it is a stimulant. But it does decrease an appetite suppressant. It's going to decrease your desire to eat. Keep in mind, you still have to eat. It's what you eat and the amount that you eat that's going to be more important. I tell all my patients, you need a minimum of 100 grams of protein a day. If you're a kidney transplant patient or someone who has kidney medical problems, then you may have to talk to your doctor about how much protein they want you on. But for the rest of us, we need more protein. You need your water. You need your sleep. You need the meditation. Even if you have to see a therapist, we have to take care of our mental, because that's going to affect us physically. There's other medications called Contrave. There's Consimia. These are other weight loss that work in different ways, and those are pills that will help decrease your cravings. If you are a person who eats more under stressful situations, or you're an emotional eater, there are pills that actually help decrease those desires. So there's a lot of different options that we have out for weight loss, but it's not just about the weight loss. You got to work out. Even if it's 10 minutes or 15 minutes a day, we need to build our muscle mass. And it actually causes release of natural endorphins. So you feel better after you work out.